Hello dear patients and our followers. I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic. Today we are going to have an evaluation and a case study of the patient who underwent the hair transplantation surgery in our clinic almost 2 years ago. It was July of 2022. The patient had a normal type 5 of the hair loss. One of the key factors for the success of the surgery is always the planning. And one of the steps of the planning is always staging the hair loss for the patients. For this purpose, we use the Norwood-Hamilton scale. On Norwood-Hamilton scale, the patients are staged from grade 1 to grade 7 of the hair loss. 1 meaning the least of the hair loss, and 7 meaning, of course, the most of the hair loss or advanced stage of the hair loss. And what we see most of the time for the Norwood type 5 and above in some patients, as we've mentioned before in our other videos, in some patients even starting from grade 4, the patient may require a two-step surgery or the second surgeries depending on their expectations and their priorities. Mentioned earlier, the patient have the Norwood type 5 of the hair loss. It means the loss of the continuity of the front hairline, empty spots on the both temples, loss of the front forelock, thinning in the front third, mid-scalp, and there is an empty spot in the crown area. So basically all three anatomic areas of the head, like the front, mid, and the crown area, is affected by hair loss. For this type of patients, on average, you may need the numbers varying between 4,500 or even up to 6,000 grafts. Of course, number of the grafts vary from patient to patient depending on the size of the open area, the density you want to get, expectations of the patient, but the most important here is the capacity or the ability of the donor area to give us sufficient number of the grafts to meet expectation of the patients. And what we see mostly for the advanced stage of the hair loss is that number of the grafts we can get per single surgery may not be enough for us to cover all the open areas per single surgery, and there can be different options. For this patient, we plan a classic two-step approach. It means with the first surgery, first of all, we rebuild the front hairline, cover the front side, add the density to the mid-scalp, and go as much as we can to the back of the head, depending on the number of the grafts, of course. And we talk about this plan in details with the patient. He decided that this, like a two-step approach, will be the best option for him. We went in with the mega session for this patient. The number of the grafts we were able to extract from his donor area is 4,800 grafts. It's actually mega, and at some point a giga session when you go beyond 4 and 4,500 grafts per single surgery. The plan was to restore the front hairline, cover the mid-scalp and the crown area. When we do the surgeries, our priority is to add most of the density to the front side and to the mid-scalp. It actually goes with the gradient, with slightly more of the hair implanted in the front side, slightly less to the mid-scalp, and the lowest number as a gradient to the crown area. And most of the time, the second surgeries may be required to add more density to the mid-scalp and cover the crown if it's needed. And as we can see, we have acquired our goal of the surgery, covered the front side with a good density, because this is the area that most is seen from the front side, and it should be with a good density. And we went as much as we can to the back of the head. We were lucky enough to extract a really good number of the grafts, not because we are very talented, but because the capacity of the donor area of the patient was really good, and an average number of the grafts in his donor area were almost close to something between 13 to 14,000 grafts. It's really, really strong and a good donor area. Here we can see the progress of the patient over the time. Like the point is, and the question most of the time we get from the patients regarding the hair restoration surgery is, when we are going to see the results of the surgery. And the point here is that hair restoration surgery is not an immediate result surgery. So when you have the surgery, you don't have the result next day. It's a journey. It's like growing a baby at some point. Like we expect to see the first results around 6 months after surgery. It's around like 40 to 50% of final results. Good results, or around 80 to 85% of the results, will take around 1 year, and final results may take up to 18, in some patients up to 24 months. Specifically, the crown area is the area where the hair follicle, the grafts, will mature the latest, and it will be almost like 90-95% of the final result. Here as a result, we can see that the patient, our aim was to restore the front hairline. The front hairline is very strong, solid, and natural. The hair restoration surgery, when you make it, it should not be obvious that you had the surgery. The best surgery is the least noticeable surgery, and we have acquired this from this patient. The hairline looks very mature, natural. It starts with some thinning in the front side and slight thickness to the back of the head. And when you look, the most important is from the sides. The men or male pattern hairlines have a tendency of slightly elevating to the upper side and going with slightly sharper corners to the side. It's called the mature or masculine hairline, and over the years, as we men get older, it becomes even more like visible. So we have to keep in our mind that men and human beings actually, as we get older, hairline have the tendency to change, and we need to keep it slightly conservative so it stays actual for the rest of your life when you're in your 40s, 50s, 60s, 70s, and so on so far. So the patient is very happy, the hairlines are very natural, the transition, or as we call it, the frontotemporal transition, is very natural. It's a really good result. The hair restoration surgery, if you're not a professional in this field, it's really hard to say whether the patient had the surgery or didn't have the surgery. You can see some thinning in the mid scalp and the crown area, and that's what we say most of the time for the patient, that they may need the second or touch-up surgeries to add more density. The patient is happy this way, and he also plans to have the surgery in the upcoming years. He is now on medical treatment to prevent further more loss of his non-transplant hair. That's also a key factor for the success, because with the surgery, we try to cover the open areas as much as possible. And the medical treatment is needed to prevent further more loss of your non-transplant hair. So it's like a puzzle. We need to keep it at the level what it is. But it doesn't mean that when you have the surgery, you must be on the treatment. No, it's strongly recommended, and if you do it, it will be even better. Thanks for staying with us. Stay tuned, and good luck.